This is Natalia Marmol, co-founder of Enevia Health. Today, I would like to welcome a doctor that has dedicated the last 12 years of his professional career to study and treat children in the autistic spectrum. A doctor that has experienced firsthand as a parent what it means to have a child on the spectrum. Welcome, Dr. Bogner. Thank you for having me, Natalia. Thank you very much. So, Dr. Bogner, he's the medical director at Oxford Recovery Centre, an integrative care facility that serves patients of various backgrounds and medical conditions. Dr. Bogner, primary interests focus on the autism spectrum research, along with finding effective treatment options. Dr. Bogner directs the Hyperbaric Center and consults with patients seeking more holistic approaches to disease. Dr. Bogner has studied multiple subjects related to the autism spectrum. One of the subjects that I find particularly interesting is the brain inflammation that most autistic people suffer. Today, I would like to bring the attention to this subject and gather what is known until now. So the causes, the culprits, and above all the treatments that we have available. So let's begin by explaining how do we know that there is inflammation in the brain? Would you mind?
Yeah, thank you. And thanks for all that you do for your children and bringing awareness to this. But yeah, we have various sources that kind of gives us the opportunity to conclude and appreciate that these children with autism are inflamed and that they have neuroinflammation. So for one, there is a researcher out of University of Arizona in Phoenix. His name is Dr. Richard Fry. He's a pediatric neurologist. Many of you probably have heard of him. And he's been speaking on Autism One conferences for years now. And the reason I mention him because he has published one paper at one point where he summarized all the research that we have in regards to inflammation in autism. And he found 112 medical research papers that confirmed that children with autism have higher levels of oxidative stress. So that's one area to look at, oxidative stress. Oxidative stress are free radicals that cause inflammation. Then we have studies from, for example, Johns Hopkins University with Dr. Vargas, who confirmed that in autism, when they did autopsies in autistic brains, that there was evidence in multiple areas of the brain of inflammation, and mostly involving microglial cells. And microglial cells, as you know, are the interneurons. It's the structure between the neurons. They connect neurons. They grab, one synapse and connect it to the next. The microglial cell is really the intelligent cell in the brain. And so they found that these cells are irritated by something. And then we have, of course, Chris Exley out of England, who has performed the autopsies on these children. And he found that these children have higher aluminum levels than even Alzheimer's disease. That's what Chris Exley used to focus on, Alzheimer's, large amounts. He's like, well, autism is another level of aluminum on top of that. And that was every single case that he performed the autopsies on. And then we have many, many studies that show elevations of very specific cytokines. Cytokines, remember, are inflammatory markers in the brain that confirm that there's inflammation. And then lastly, of course, we have multiple studies that measure the perfusion in the brain. And they found that in children with autism, we have less perfusion. And we do that with SPECT scans or functional MRIs. Every single studies in every single patient with autism showed that they have hypoperfusion of the brain, specifically the frontal lobes. Now, whenever you have less blood flow to an area, it's because it's inflamed. If I have a spider that bites my hand, it gets really swollen and red because my immune system wants to clear the toxin. And so it's so much of it comes in here, though, that my hand is red and heavy and swollen, and there's less blood flow. And so the same happens in the brain. If you have too much inflammation in the brain, then there's less blood flow. And so specifically for the frontal lobes, where it is occurring in autism, and also, interestingly, in schizophrenic patients, you have less speech development, the memory is not good, and so forth. But what we are really interested in is how to treat it.
Indeed.
And to identify what causes it, because I know that these children are inflamed. I don't need to convince anybody to do that, because we all know that they're inflamed. If they wouldn't be inflamed, there wouldn't be autism. You know, if you look at a brain, autistic brain with an MRI, no radiologist in the world could tell you, oh, this brain is autistic. So there's nothing structurally wrong with the brain.
Mm-hmm.
It's all the chemistry. And that's what we're really looking at. Later on in life, yeah, you can see some abnormalities. You know, they have initially heavier frontal lobe involvement. Later on, it shrinks. They have lower frontal lobes, but it's because the reason, as you will find out as when we will have our discussion, is that what causes the inflammation of the frontal lobes, I believe it is a hyperactivation of the frontal lobes, a hyperactivation of dopamine, like massive amounts of dopamine. And that, you know, burns out the neurons because they're constantly being activated, and that eventually will burn them out, and you have hypoperfusion and inflammation. So, but yeah, in a nutshell, that's it.
I'd like to ask you something, because there's a lot of talk about the inflammation, and then a lot of parents want to translate that into their, let's say, everyday. So how can we prove that there is this inflammation? I know what you said about all these tests, but most are tests that requires, you know, sedation, and they are complicated. So I like to ask you about the cytokines. So how reliable are, if you do a blood test and you want to measure them, would you get a realistic view by one time that you take those cytokines at that moment?
No, and I don't really know what purpose it would serve. That would still be under realm of, you know, I want to prove that my child is inflamed. Like I said, we skip that. We know they're inflamed. Why prove it? Because, you know, in my opinion, every disease in humans, I don't know of any that's not, is involved with inflammation. You know, we talk about cancer, autoimmune disease, autism, trauma. Everything is based on inflammation, one way or the other. And the reason for that inflammation has two reasons: toxicity and deficiency. So it's the amount of chemicals versus your defenses, you know, and the genes that mix it all together. And so that is what's important. And so I don't do at all testing to see if these children are inflamed, because I know that they are. So why waste time with that? And in regards to what would I check, I don't do any blood testing for my children at all. I think it's worthless. What can you find in the blood? It's a sterile fluid, and any chemicals that are in the blood get pushed off into your tissues. So, for example, if you don't find aluminum in the blood, then that doesn't mean that the child is not, you know, toxic with aluminum. But with cytokines, it's, you know, there's TNF alpha, for example, that's elevated. There's interleukin 6, these kind of things. There are labs that check that. I know there's this Australian lab that does it specifically for autism. I don't see the benefit, because let's say it's high, then how did that help you? How are you going to change things?
But how do you track progress? It's more like seeing the child evolve more than by biomarkers, let's put it this way.
Yes. And, you know, when we have a patient come in here with, you know, a patient with their parents, we sit down for an hour. You know, I want to know, sure, your child is autistic, but how does your child sleep? What does he eat? How does he poop? What are your concerns? You know, is he high functioning, low functioning? You know, did you get vaccinated during pregnancy? Did you take a lot of antibiotics? Did your child need a lot of antibiotics for ear infection? Like, all of these things are important, more important than knowing if the cytokines are high, because that has already been done. There's so many studies out there that show in autism there's inflammation. 112 studies that show there's oxidative stress. I don't need to reinvent the wheel. I want to have solutions, you know, for these children, and discuss with the parents, you know, educate them about what is important. What do we need to look for to get your child better? Because it's not happening overnight, but we have a lot of children that turn around incredibly well. And it's a lot of work, but it's possible. And that's the beautiful thing. It is possible. It's not that this is a forever thing, you know.
So tell us, step one.
Well,
what's the first thing that
first,
someone should be thinking? As in,
I'm sorry?
So what's the first step when someone is trying to tackle, let's say, the inflammation problem? So how do you start?
So first, of course, we start with a very, very thorough history. We have first one of our nurses discuss with the parent for 45 minutes, get all the information, medications, supplements, previous treatments, lab results. Mm-hmm. And then they see me for 1 hour on top of that. And then we recommend testing. And usually in regards to testing, we do a genetic test, mm-hmm. And we do a neurotransmitter test. And so the genetic test checks for 120 different genes that are involved in various processes that we have, you know, scientific evidence behind it. As you know, we have 20,000 genes, mm-hmm. but it's not that we have data on every single one, what they do. And so we check 120 that we very much have lots of data on. For example, the gene that makes glutathione bind to the chemical. That gene is called GSTP. We check it. We see what is your binding capacity to a chemical, or we check MTHFR. Many people know about MTHFR. It's just MTHFR is the last gene that codes for an enzyme that mm-hmm. activates vitamin B9. That's all it does. But we check 120 of them that we know that they are involved in these processes with autism that could be helpful, such as detoxification. You know, what are your abilities to bind chemicals? What are your abilities to reduce inflammation once inflammation has already formed? And then, of course, the genes that are responsible for breaking down neurotransmitters. That's why we do a neurotransmitter test. You know, maybe if I share my screen, I can show you a little bit better. Perfect. About what I'm talking about. So you see here, and I can send you this or your listeners anytime anybody would like to have this graph. But as you can see here, I don't know, do you see that pretty well, Natalia?
Yes, it's perfect.
So you can see it looks complicated. It's really not. It's kind of a little bit of an enhanced version of this guy called Ben Lynch. He wrote this book, Dirty Genes. He's a very smart. You know him?
Oh yes.
Yeah, you should have him on. He's very smart.
I tried, but it's still difficult. So eventually one day.
Famous. Okay. I'm not famous yet. Anyway, so I don't want to be, but I'm very glad to discuss this with you if it's not too boring. But you see here, if you want to categorize this, you know, all of this here that I'm highlighting, it has to do with the abilities of the body to mm-hmm. Basically form glutathione. Because glutathione binds chemicals and then you get rid of them, right? Now, if we find out for any reason that your child with autism does not produce a lot of glutathione, well, what happens then? What happens then is that glutathione does not bind to chemicals. And as you know, 70% of glutathione is produced in the liver. Mm-hmm. So when you don't have that and we have a lot of chemicals coming in, a lot of chemicals will not be able to be bound to glutathione. And what happens is that they start entering the bloodstream. Mm-hmm. And when they enter the bloodstream, you know, the chemical has two ways where it can go. It can be peed out. And the other option is it can be stored away in your fat, in your bone, in your brain, right? And it turns out that most chemicals that are used in the industry, and in the United States, we have about 30,000 chemicals registered with the EPA that are used in the industry, food industry, manufacturing industry, but a lot of chemicals. And so, you know, for autism, it's, in my opinion, ludicrous to find which chemical is responsible because, you know, it's not always aluminum. We have a lot of kids here that have never had a vaccine in their life and they're autistic. But the problem is that once the chemicals enter the blood, the chemicals rather want to go into your fat because most chemicals in the industry are very negatively charged. That means they have a lot of electrons in their orbit. And the problem with that is when the chemicals have a lot of electrons in their orbit, it makes them negatively charged, meaning they are more lipophilic. They rather dissolve in the fat than you dissolve it in water and pee it out. And so they're on their way to the fat, but on the way to the fat, the body has one more attempt to get rid of the chemical, and that is by bouncing oxygen off the chemical. Because the oxygen will steal an electron, it makes the chemical more positively charged and you can pee it out. But that comes to the expense now of having a free radical form. So you see here in the right lower corner, you see this free radical. It's called superoxide. It's simply an oxygen molecule with an extra electron, which comes from the chemical. And that's what causes inflammation. It's not truly the chemicals that cause inflammation. They do indirectly, but what causes our damage is oxidation, which is free radicals. And so that means the less glutathione we have, the more free radicals form, because the chemicals enter the blood and oxygen reacts with it. Now, our body has defenses built in. You see, all of these circles are genes, and the defenses break down the free radicals to hydrogen peroxide and ultimately water, which is harmless. But you see, if you have problems with these genes, especially here, to reduce hydrogen peroxide, which is still reactive, you need not only this gene functional, but also glutathione. And we said glutathione was the thing that caused the free radicals in the first place, because it couldn't bind the chemicals. And we know we have many, many studies that show that in autism we have very low glutathione. And so it's just very important to realize that's why we have 112 studies that show that these two guys here are very much elevated. So we have a lot of inflammation. And you will see how important that is in autism, because it, in my opinion at least, and that's what we're studying with our local university here, is these free radicals burn adrenaline. And it's a very fascinating concept, really, because a new chemical is formed, and when the free radicals burn the adrenaline that the child couldn't break down because of problems with this gene and problems with the nutrient that stimulates that gene called SAM, which comes from, as you can see here, from methylation. Methylation is a process where you use vitamin B9, B12, homocysteine. They all get cooked up by this gene and form methionine. And methionine is an energy. It's what we call a methylation energy. And as you can see, it forms into S-adenosylmethionine. And that is so important for the brain, because you see SAM is everywhere, helping genes to break down neurotransmitters. And you see, if you're missing it, because you have methylation problems, because this gene, as you can see, that pulls it all together is one that is inhibited by aluminum, for example, or mercury, or lead, or hydrogen peroxide, like we said down here. So when that happens, we make much, much less SAM. And you see, if you have this gene problem breaking down adrenaline, with the SAM missing too, you have very high adrenaline. And you know, that explains a lot of these children, they cannot sit still. They're constantly moving. They're hyperactive. They don't sleep at night. And they have gut issues. You know, the question in autism is, why do these up to 94% have gut issues? Yeah. Is it because the gut issue caused the autism? Or is it because first there was something else that caused the gut issue? That's what I believe. That's why I don't believe that, for example, stool transplants are the final solution, or at least you would always need them, you know, every so much, because the primary issue is not the gut. It's a secondary issue. The primary issue is high adrenaline, because high adrenaline shifts blood flow away from the gut towards your muscles, neglecting the GI tract, and it changes the immune system as well. And so I believe that autism, the primary problem is adrenaline. Adrenaline metabolism is abnormal. And so the more adrenaline accumulates, the more gets burned with the free radicals, and that forms a new chemical. And let me show you a different graph here. That's maybe too much. Just to give you an idea here. So you see, adrenaline, we said, reacts with the free radicals. The reason that we have both high is because, well, adrenaline gets broken down by this gene COMT to metanephrine. But if you have it compromised, well, adrenaline accumulates. And then the free radicals, like we said, most of them stem from the gut, because most of the glutathione, we said, is made in the gut and in the liver. If you don't have it, well, you form more free radicals. And so they react into adrenochrome. And adrenochrome is simply oxidized adrenaline. And that is not a good thing to have, because adrenochrome has been shown to cause psychiatric symptoms when they infused this into volunteers. They did most of this in the 60s, and when they infused this intravenously to volunteers that were healthy, they developed symptoms of schizophrenia. And some of them you can see here: euphoria, hallucinations, bizarre ideations, introversion, visual aberrations, and bizarre inappropriate behaviors. And so what if, you introduce this chemical to an adult? Well, you have the patient tell you how they feel. But what if you would infuse it into a child? Or what if the child has high adrenochrome levels? They cannot tell you that these things are happening because they've never learned to speak. And so I believe that this is what happens in the children with autism, long story short kind of thing. But what we need to do is basically look at the genes that are responsible for all of these, see if that's the case, and then, lower the amounts of adrenaline. One big thing, sugar. And maybe let me give you a better graph that I'm using for my paper that has not been published yet. But probably this is a better view of everything, a better view of autism. So it explains almost everything, I would think. You see, if you want to start up here, ultimately, what we don't want is adrenaline, because adrenaline, as you can see here, gets broken down. But if we have the gene problem, ultimately can cause the adrenochrome, adrenoleutin, and that causes excess dopamine release in the frontal lobes. And that's why I believe the frontal lobes are basically too overactive, creating this inflammation in the prefrontal cortex. But it's just very interesting to see what leads to the formation of adrenochrome and adrenoleutin. For example, if you look at this here, adrenochrome, it cannot be measured really in plasma because it only exists for a couple seconds. Okay. And when they infused it into volunteers, the adrenochrome, you had symptoms for a couple hours, but it quickly went away. Not so much though with this chemical here. Adrenochrome further gets broken down to adrenoleutin. One of the big triggers is aluminum. And adrenoleutin, when they infused that into volunteers, they had symptoms for up to a week. So it's very powerful, very strong ligand, and that's why aluminum, in my opinion, for those children that accumulate aluminum, they couldn't get rid of the aluminum. The aluminum is forming a lot of these chemicals that can cause these behavioral problems. Just to give you an idea, adrenaline needs to be there, and inflammation needs to be there. You see free radicals and adrenaline. In the first 2 years of life, a person has the highest amounts of adrenaline, especially when the child is born. So when a child is born, as you know, adrenaline opens up your lungs to leave more oxygen in, and it releases sugar because the sugar is there for your muscles, right? Fight or flight response of adrenaline, because your body needs energy to run away or to fight. And in these children, when the adrenaline is high, it, as you can see here, releases sugar. And hyperglycemia creates more secretion of insulin. And more insulin then, lowers your blood sugar transiently. And so when the blood sugar goes down, these kids get very, very hungry. They get these cravings of sugar. And that's why they only like to eat sugary foods, carbohydrates. Yeah. And that then brings your sugar back up and you feel better. But for example, if you don't eat something very sweet when you are in the state of the sugar going down, what happens? Have you ever heard in Spain this term, you become hangry?
Yes.
So that means you become very angry if you become hungry.
Mm-hmm.
Why is that? It's because when the brain doesn't get glucose,
Mm-hmm.
what happens is that the body releases adrenaline because it wants to release stored sugar from the liver. And so when that happens, you become angry. And so that's why transient hypoglycemia would release more adrenaline. And because those individuals cannot break it down, you have high adrenaline. And the more inflammation you have from allergens,
Mm-hmm.
which you couldn't bind because you have these genes messed up, it will oxidize it to adrenochrome. It's as simple as that. And then, of course, the aluminum gives you the long-term effect. So even if you put your child in 2 days of perfect organic diet, they have no change because this is still active. So it will take some time.
So
but that's basically...
Sorry, I was going to say, how do we support our COM, the COM gene? How do we support, how do we go from the beginning in order not to get to the point that we are producing so much adrenochrome? And
yes, so like I said, let's go back maybe here. So if we look at this again, what do we need to do to prevent adrenochrome from forming is we need to reduce the adrenaline. So that means we have to stop its production and we have to enhance its degradation. Now we can look, to stop its formation, obviously we need to change the diet. No sugar is allowed. Sugar raises adrenaline, like we just discussed, because of the insulin going up. Interestingly, if you have gestational diabetes, for example, in your pregnancy, you double your risk of having a child with autism. Why? Because the sugar goes to the baby secretes more insulin. Insulin doesn't cross the placenta, remember, but the baby will by itself then increase the insulin. That was low blood sugar and the baby's already highly adrenalized. That's why you double your risk with pregnancy. Or the other thing is stress, of course. We all know that if you're stressed, you have more adrenaline. So that's kind of a hard thing to modify, in a child with autism. It's just, all you can do is you just love them. Love them, love them, love them. Don't get upset with them, be patient. That's all you can do in that regard. But the last thing is very important is allergens. And so remember, when I mentioned that the chemical that couldn't be bound in the liver because of glutathione now enters your blood. And we said they can go 2 ways. They can go, the chemical can go to the fat, or you can pee them out. But whenever that happens and the chemical enters your blood, the body also releases massive amounts of histamine, right? Histamine, remember, if you get stung by a bee on your hand, or you eat a peanut, and you're one of those persons who has anaphylaxis, what that means is the body exaggerated its response and massive amounts of histamine gets released, which dilates your blood vessels, right? And you have hypovolemic shock. Now, when you're one of those persons and you go to the ER, what do they give you? They give you a shot of adrenaline, right? And so when you have a lot of chemicals that enter the blood, the body naturally secretes lots of histamine. And then we have to look, well, how is the body equipped to break down that histamine? That's done by genes again. DAO, HNMT are genes that break down histamine. So if you have additional problems with these genes, well, then your histamine levels are even higher. And as a natural response to high histamine, just like the adrenaline that you get in the ER, the body secretes adrenaline to burn the histamine. So that's why chemicals are so powerful to raise your adrenaline. And then, of course, we have to see what helps with the breakdown of adrenaline. And I keep going back and forth, I know, with my graphs here, but you see, if we look at this again, we look at adrenaline. As you know, another name for adrenaline, obviously, is epinephrine. But see, what helps with the breakdown is SAM. So we need to fix methylation issues. We need to see where's SAM coming from. It's coming from here. But you see, a very important thing I want to tell you is that I never give children with autism methylated vitamins, because that will backfire, and it certainly backfired for my son. But you see, it's a problem having too little SAM, but it's also a problem having too much of it. Because you see here, let's say your child has 2 copies bad here with the gene.
Mm-hmm.
And you see SAM breaks down, helps the gene to break it down, but it also stimulates the production of adrenaline. So you see, if you now give your child, let's say B12 injections, right? Methylcobalamin, you give the injections, you very aggressively produce lots of SAM. And see, the problem with that is that if you produce lots of SAM, well, look, you break it down, but you also produce a lot. And if you have a problem with this gene, but not this gene, well, then the net effect is that you accumulate lots of adrenaline. And the B12 injections would make your child more aggressive, more hyper, and so forth. Wouldn't sleep. And that's why be very careful with methylated vitamins. I never give them. You want to give the other forms, hydroxy B12, maybe adeno B12, if your child is not too hyper. Methylfolate, you give folinic acid if they don't have a problem with this gene, so they can tolerate it. But that's how we have to go, very carefully analyze what exactly does your child need? Where are the gene problems? You know, we walk a patient through all of these genes. We tell them, oh, you have a problem here or not, because we cannot change the gene. But for example, we can stimulate the gene. For example, if this gene doesn't work, well, we can stimulate it with zinc. Right. Or we can simply go up with the substrates here. So we have to be careful of what we use. But that's basically it. You know, magnesium, for example. Why do people take magnesium? We have a product here in the US called Calm. It's magnesium citrate. It's called Calm. Well, it calms you down, apparently, because you break down adrenaline. Yeah, and so methylation needs to be fixed. Magnesium is always good. But what prevents adrenaline formation, and that's a fascinating thing. You know, there was a psychiatrist in Canada. His name was Dr. Hoffer. I'm not sure if you've heard of him, Abraham Hoffer. Mm-hmm. He was a psychiatrist for 50 years in one of the largest psychiatric hospitals in North America and Canada. And he had over 50 years about 5,000 patients, mostly schizophrenic patients. And as you know, schizophrenia and autism are very closely related. In fact, I believe it's literally the same process. Until 1980, in fact, autism and schizophrenia were one and the same diagnosis until they split, you know, this DSM-3, it was in 1980. And then they separated autism and schizophrenia. But until then, it was the same. The first time autism was described, it was actually described as a symptom of schizophrenia. So anyway, Dr. Hoffer treated his patients very successfully with niacin, his schizophrenic patients, because niacin, which, as you know, is vitamin B3, nicotinic acid, what it does, it accepts methyl groups. So it prevents that adrenaline gets formed in the first place. And he literally reversed acute schizophrenia in Canada and had good success with chronic schizophrenia with niacin. And certainly I had very big success with this with the patients that have schizophrenia in my office, and good success with autism. But as you can see, it's just one piece of the puzzle of what needs to be done. We need to fix methylation, detoxification, diet, and then support all of these nutrient deficiencies, heal the gut, all of that behavioral therapy. And so as you can see, it's a lot, but it's one step at a time, and patients get better. I wouldn't sit here today to tell you this or waste anybody's time. It's really a beautiful thing to witness.
Well, it is good to know from the doctor's perspective that there are so many things that can be done. One thing that I heard you in a conference that you gave in Autism 1 in 2009, I think, you were talking a lot about the hyperbaric chamber and how it works for decreasing the inflammation. I really would like to talk about that because that is something that people wonder. There isn't enough information. Mostly there isn't enough information related to autism. So if
very good. So, well, let me stop sharing for a second. So first off, hyperbaric oxygen, maybe let's start from the beginning. What it is, it's breathing 100% oxygen versus right now we're breathing 21% oxygen, right? So it's already 5 times more oxygen, but then we also apply pressure. And pressure meaning just simply add more and more oxygen until it builds up. It's equivalent to approximately 33 feet underwater that we put our patients in. We call it 2 atmospheres. And so what that means is that you have all of this oxygen dissolve in your plasma, so much of it that, you know, for example, if you breathe right now room air and I would measure your pulse oximeter, it would tell me probably something like 98, 99%. That means 98 or 99 out of 100 red blood cells are saturated with oxygen, right? So there's not much more you can do, really. But what hyperbaric oxygen is, we put so much oxygen in there, expose our patients to so much oxygen that there's so much oxygen that dissolves in your plasma that you could have somebody in the chamber and drain all of their red blood cells and the patient would continue to survive just based on the oxygen dissolved in the plasma. Why is that important? Well, think about it. If my hand is inflamed and it's really red, right? This little muscle here, my finger, doesn't get a lot of oxygen because there's a traffic jam, right? So much more blood in here everywhere, very low blood flow. That's why this area, this muscle, has to produce energy without oxygen. And when a cell has to produce energy without oxygen, lactic acid is always the byproduct. So that's why there's a lot of acid, it hurts, and you're more prone for infection, for example. But let's talk about the brain. So if we have adrenochrome stimulating excess amount of dopamine release, and your frontal lobes become inflamed because dopamine, if you hit on a neuron over and over and over, they burn themselves out, you have the same thing. You have a traffic jam. And so if you would just breathe oxygen, remember, oxygen binds to the red blood cell. So it's a big complex. And it wouldn't necessarily get to the area. But now we have oxygen dissolved in the plasma. It's just oxygen. It's a tiny molecule. It's 2 hydrogen and an oxygen molecule, an O. And so it's very small. It's similar to, think about on the expressway. You have a terrible accident. And you have miles and miles of traffic jam before it because nobody can pass. So if you have the ambulance here, the cure, it can't get there because of the traffic jam. But what you can do, you can have a mobile motorbike first aid, right? And you go in between. So that's what hyperbaric does. It simply exposes the oxygen to the area that needs it the most. And that's why, you know, when the tissue that was deprived of oxygen gets a lot of oxygen all of a sudden, it says, hey, I have enough, let me constrict my vessels, and that alone takes away the inflammation. Now in autism, that's why I want to share my screen here. You see, what does it really do on a molecular level? So if you look at this here, remember, what we talked about is that a lot of these children have problems here. In fact, when I checked for the study that we're doing right now, I reviewed all of the autism cases that we have in my clinic. And so over the last 3 years, those who've done genetic tests, we had about 100 patients. Just who did all of the testing that were included. We see more, but not everybody always gets the testing. You know, these things are not cheap. But 100% of all children had an involvement with these SOD genes. Every single child. There's not one that didn't have it. And there's even in the literature described that children with autism have lower. So it's confirmed not only by our patients. But so that's an issue to reduce these free radicals. We often see problems with these 2 genes, but it doesn't have to be. But all of them have low glutathione. So how could we help these children? Of course, we can give glutathione, but see, if these genes don't work very well, it's still problematic. And so we can, the bottom line is, we can help these genes to express themselves, specifically those. And the reason why hyperbaric oxygen helps with the expression of these genes is because of a system called NRF2, if you want to look that up. Now, NRF2 is if you think of it within a cell, NRF2 is a protein that's attached to what we call an inhibitor, and it's not active. But oxygen goes in between the inhibitor and the NRF2, and the NRF2 is now free, and it goes to our nucleus, the DNA, and stimulates the expression of exactly these genes that NRF2 stimulates. So these genes are NRF2 receptive. And so what happens is that in one study, we have 400% more expression of these genes. That means you go in the hyperbaric oxygen chamber, the oxygen acts as an irritant, it's a reactive oxygen species, and that stimulates these genes to express themselves. And when we take the patient out, the genes will continue to do that. And that's why hyperbaric oxygen is so powerful to reduce inflammation, simply because it stimulates these genes to not only bind more chemicals. Hyperbaric oxygen is a great chelator, but also to reduce existing inflammation. And that's why it's so powerful. We have approved conditions and off-label conditions, and autism would be an off-label condition. But some of the conditions that are covered, for example, by the insurance are carbon monoxide poisoning, cyanide poisoning, ocular stroke, very bad wounds, for example. Why would all of these things work with hyperbaric oxygen? It's because you reduce the inflammation, and once you reduce the inflammation, the body knows what to do, because you simply need to access that area with the immune system and with nutrients to path the way. And that's, we treat a lot of cancer patients here as well, and have some good success with that. Why is that? Because cancer, as you know, thrives under very acidic environments. The more hypoxia or the more pH drop you have, the more metastatic potential of a cancer there is. There's no physical wall that the problem is in cancer, like an abscess. The problem in cancer is acidity. The cancer grows so fast, outgrows its blood supply, that it has to divide without oxygen. And again, the byproduct of that is lactic acid. So it grows so fast, produces a lot of acid, and that acid lowers the pH locally where the cancer is. So when the immune system comes in, the immune system is pH dependent, it doesn't work. It gets inactivated by the chemistry of the cancer. That's why oxygen penetrates that, takes down the acidity, and it's not that the oxygen kills the cancer, it's that the oxygen paves the way for immune system to come in and clean up. And so that's the same thing in autism. In autism is you take away the inflammation in the brain, and the brain starts working again. The parallel study that we have from our director of ABA here, ABA, I'm not sure if it's the same name in Spain, but it's applied behavioral analysis.
Yeah.
Do you have that too?
Yeah, we call it ABA. So. ABA,
yeah. And our person that I'm working with here, she always says, if we have a patient in ABA and a patient in ABA and hyperbaric oxygen, so basically in the morning, we get their brains oxygenated and then they have their therapy, we have found that in the first 4 weeks, we have 75% more spontaneous speech compared to the ones only taking ABA. So that means, we measure different aspects of speech, like manding and spontaneous and using it in a sentence. And we have the data and to show that, they speak more. It's pretty phenomenal. So that's what hyperbaric does. It's also known to release stem cells. Usually it's the first thing that people mention. I don't know if it's beneficial, stem cells, because as far as I know, there's nothing structurally wrong. It's not that you have, like in a stroke patient, an area of necrosis or death, cell death. I don't know where necessarily the stem cells would be of benefit, but hey, they're there anyway. We have 800% more stem cells by 20 treatments. But overall, it's really this mechanism here that's so powerful for these kids. So.
What type of pressure, in your experience, so I'm assuming you've probably done different trials. So in your experience, what is the best pressure? What's the best time to be in the chamber?
And again, it's just what we use. I don't know because if I would, it would require studies. But basically, our technicians and our directors in the ABA program can tell once we hit 2.0 because we start everybody at 1.5, which is the definition of hyperbaric oxygen. Anything below you should be very careful about, such as the soft chambers, the soft bags. You have to be careful because that oxygen can actually stimulate aerobic bacterial growth. With hyperbaric oxygen, that doesn't happen because it causes the respiratory burst. That's another discussion. But at 1.5 we start, but once we hit 2.0, changes occur. And so we keep them usually at between 2 and 2.2, but we usually don't go higher than that. For autism, we do go higher for Lyme disease to like 2.4, but
and you do 1 hour and a half, right?
Yeah, we do about an hour and a half. 7 minutes. Usually it takes 7 to 10 minutes to get you to the pressure, then 1 hour and 15 minutes back up.
And do you recommend your patients to do like how long would you recommend them to repeat?
Yeah, that's a good question. So most research for any condition, that wounds or carbon monoxide poisoning or stroke or Alzheimer's, most research, they use 40 treatments. It's the magic number for what reason? It's not because we want to make more money with 40. It's just all across the world, most research is based on 40 treatments. And we know that if you stack the treatments on top of each other, meaning every day, then overall by 20 treatments, you have 800% more stem cells that are circulating. So we know that the more you do, the better. It's like working out a muscle. If I work out today, the muscle thinks, he might work out again tomorrow, so let's grow. But that's the same with the genes. But we usually do 40, and so that can be done in 8 weeks, Monday to Friday, every day. And sometimes for certain patients that don't have 2 months, we do 2 dives per day. It just has to be 4 hours apart. So, but in general, 40. And then, usually 2 or 3 rounds in a lifetime if you're really dedicated to really stack the improvements every year. I mean, we have patients come back that had 500-600 treatments over 10 years, and they keep coming back, not because we tell them, but because every time they see a little bit more improvement, significant enough that they want to pay for it and come back. So it's a lot of work. It's very stressful every day to come here, get changed, go in the chamber, go back home. It's hard. But we have patients from all over the world come all over the country here, and every day we have about 30 to 50 kids with autism in our center and about 50 patients who dive every day. We have 8 chambers, and we're expanding our autism program. We built another building next spring. We're going to be 70,000 square feet, all autism. It's really so many patients need our help, and
your facility is something that we dream about, let's say, in Spain. I mean, such a big place full of different...
Spain is what I dream about, so...
Well, maybe we can do an exchange. You guys can come and set up something here. We'll be very happy if that were to happen.
Oh, we would love to have all of these things are very expensive, of course, but I saw in the beautiful pictures on your website, you have nice chambers and everything.
Well, there are centers in Spain, but there isn't a center that holds all these therapies under one roof. So generally,
is it far from Barcelona?
No, I mean, you need to go for this therapy. You need to cross the country and go here. And then I had to cross the country to go to the hyperbaric chamber because near me there was no one doing it. So it's not easy for us to reach. So generally,
so it's and I want to remind you, it's not that you have to do this. It certainly is a great technology that helps, but it's also not your silver bullet. You can't expect to go in there and everything is great if you don't change the diet, if you don't change the things that caused this problem in the first place. You know, it's accelerating things, sure, but you don't have to have hyperbarics. It's a luxury for us to have it. Of course, we recommend it, but yeah.
No, again, it's one more thing that it's there and that it helps, as you said, you know, with the inflammation. I think that it's one more thing that it adapts to all the treatment that needs to be done.
Right.
So anyway, I think we're finishing our time, and I know that you need to, well, that it's about time. So is there anything that you would like to tell our audience? Something that you'd like them?
I know one thing we haven't touched upon yet is the DMT, and maybe it's a little bit too much for this discussion, and I certainly can come back.
No, you have time. Please, I'll be
so I'm in the middle of, you know, exploring everything myself. I don't have all the answers, but I'm just a researcher like you. I'm just a father. I have 4 kids. My 15-year-old has autism, and so I'm in the same boat as any of your listeners or you. I'm no different. But in my research, you know, I'm pretty convinced that these children have higher levels of adrenaline. There are 5 studies I can show you that show they have higher adrenaline, but it's never been shown to have higher adrenochrome. And that's what we're trying to measure here. But, you know, the thing is, adrenochrome by itself, with the hypothesis that, you know, because they have measured where does adrenochrome dock onto, what receptor? And the receptor it docks onto is called alpha-2C adrenoreceptor. And that receptor is found in the prefrontal cortex, the striatum, but also in the pineal gland. And, you know, thinking about, well, in the prefrontal cortex, that receptor is on what we call DA cell groups, which are dopaminergic cell groups. So meaning if adrenochrome docks onto that receptor, it releases lots of dopamine, which I believe, okay, that causes the inflammation. But dopamine doesn't really cause hallucinations. And the interesting thing is that, you know, when I talk to my patients here that have high functioning autism, you know, those that are teenagers, you can tell they have autism, they have the diagnosis, they are, you know, socially awkward, I guess. They're very smart, but they can express their feelings at times. And when I ask them if they can see things, almost all of them say yes, they do. Colors, rainbows, snakes on the wall, people, and so that means it cannot be just the dopamine. There must be something else going on. And so when I realized that that receptor is also in the pineal gland, and remember the pineal gland secretes melatonin, we know that. But because it has adrenoreceptors, maybe the adrenochrome is the key to unlock DMT release. So DMT is basically that molecule that makes you dream, right? Or have, you know, when Rick Strassman, he's a psychiatrist from New Mexico, basically when he infused DMT into volunteers, they had very profound psychedelic experiences. You know, some people go to the rainforest to drink ayahuasca, and ayahuasca is a tree bark that contains DMT, and they mix it with another plant that contains an enzyme that prevents the breakdown of DMT. We call it MAO inhibitor. And so when he infused this into his patients, they had psychedelic experiences unbelievable. Like they left their body, they met entities, they saw geometric shapes and all that. But what if in autism, the adrenochrome releases the DMT? Because let me show you this. There's a study that is very interesting, and I contacted the researcher for it. His name is, which one was it? Oh no, actually this is not the guy I contacted. This is actually from Italy, from Pavia. Now what they found is that there are elevated urine levels of this chemical, bufotenin, in patients with autism and schizophrenia. And this chemical is the direct breakdown product of DMT. And which is very interesting. So if you look at, for example, one of the tests that we do here, the neurotransmitters, for example, is this. So we see, this is an autistic child, very high levels of dopamine, which would make sense with the adrenochrome. But then you see here, very low levels of adrenaline, and that's because all of it gets oxidized to adrenochrome. That's why it appears low, but actually adrenaline is very high. And then look at this, tryptamine. Tryptamine in this patient, and I see this in a lot of autistic patients, very high, more than 200% elevated. And tryptamine, remember, is the core building block for DMT, LSD, mescaline, all of these psychedelic drugs, and also serotonin, of course, but especially DMT. And, you know, what if the DMT is higher in these children, which would mean they live in altered realities. And, you know, their perception has changed. And so that's why what we need to do is we need to bring them to our reality. And, you know, that's why it's so hard to teach them something that sticks, because it doesn't make sense to them in their reality. And so that's the short version of DMT. We can have a whole show about this if you want. I probably flew over a lot of this information, but I'm happy to come back anytime to discuss with your audience, and maybe even have some questions from them or whatever. I'm trying my best to help.
No, I mean, that would be wonderful, because I mean, I know that after the talk, many people will have questions, and obviously today we've gone through many different subjects, kind of going. So if you have time, we would be really happy to go in detail into one subject. The adrenochrome, the theory that you're formulating is really interesting, and I think that it giving explanations of some things.
And we do counseling, of course, worldwide. We have Zoom like this, where we can show the results, you know, online. We walk patients through everything, give them recommendations of what to do, which nutrients, what form, how often. And if anybody's interested, of course, you know, check us out. The website you probably have. Email us anytime. We're here to help, not to profit. We're here to help, and that's my passion. I do this. I used to be in another profession, but I left to focus only on this. So.
Well, and I think it's let's say unfortunate what it brings you here, but I think it's thanks to some doctors that happen to be parents also of autistic children.
Yes, otherwise I had no interest in autism.
I know,
Just like I have,
or anyone else. I mean, we all here because we've been, let's say, forced, but I guess that it's because of this force that it's driving all us to keep on pushing, because there's nothing that will drive you more than a child. So
well, there must be a reason, like smart people like you, because you're helping others now and bring the word, and maybe one day we'll cure it. We can't give up until that day happens. So
that's for sure. We'll keep on going, and we'll keep on researching, and we'll keep on doing whatever we can to help our children. Doctor, I really appreciate your time, and thank you very much. And hopefully we'll see you another time. Thank you, doctor.
Thank you for all you do, Natalia, and I'm back anytime you want. Okay. Thank you.
Thank you. You've been very kind.
And thanks to your listeners. Thank you so much. Bye bye. God bless.
Well, thank you very much. Thank you, doctor. It's been
okay. Well, thank you. I'm gonna run, okay, to my children.
Okay.
Have a good
Take
night.
care. We'll see you next time.
Thank you so much.
Bye. Bye. Bye.